Preschool language disorders. What is a preschool language disorder? Most infants or toddlers can understand what we are saying well before they can clearly talk. As they get older and their communication skills develop, most children learn how to put their feelings into words. But some children have language disorders. They may have receptive language disorder. A child has trouble understanding words that he or she hears and reads. Expressive language disorder. A child has trouble speaking with others and expressing thoughts and feelings. A child will often have both disorders at the same time. Such disorders are often diagnosed in children between the ages of 3 and 5. What are the signs of preschool language disorder? Receptive language disorder may have trouble in understanding what people mean when they use gestures like shrugging or nodding, following directions, answering questions, pointing to objects and pictures, identifying objects. Expressive language disorder has trouble using language even if they are able to understand what other people say. Using words correctly, expressing thoughts and ideas, telling stories, using gestures, asking questions, singing songs or reciting poems, naming objects. What causes language disorders in a child? A brain disorder such as autism, a brain injury or a brain tumor, birth defects such as Down syndrome, Fragile X syndrome, or cerebral palsy, problems in pregnancy or birth such as poor nutrition, fetal alcohol syndrome, early or premature birth, or low birth weight. Sometimes language disorders have a family history. In many cases, the cause is not known. How can language disorders be treated in a child? The speech language pathologist SLP will help the child learn to relax and enjoy communicating through play. The SLP will use different age-appropriate methods to help with language and communication. The SLP will talk with the child and may use toys, books, objects, or pictures to help with language development. Let the child do activities such as craft projects. Make the child practice asking and answering questions. Guide the child to use other ways to communicate when needed. This may include simple gestures, picture boards, or computers that say words out loud. This is augmentative or alternative communication, or AAC. Learn early reading and writing skills. How can parents help the child live with a language disorder? Ask the SLP what should be done at home to help the process. The SLP may advise simple activities such as reading and talking to the child to help learn words, listening and responding when the child talks, encouraging the child to ask and answer questions, pointing out words on signs. Disclaimer: this information is not a substitute for professional medical advice, diagnosis, or treatment. Please consult a doctor for further advice.